It's unacceptable, and we can do something about it. There are two people who have the ear of the public, understand the politics involved, who can make those changes. And the two of them are apparently right back here. So, without further ado, I want to introduce first our Congressman from the 3rd District of Oregon, and who's a pen, if you haven't gotten a bicycle pen, be sure to get one, Earl Blumenauer. And a person who I have an incredible amount of respect for, because I've gotten a chance to see him actually accomplish so many things nationally, as well as somehow manage to lose weight, which I'm still trying to figure out how he did that. I'm still needing to do that. But he has done extremely well, and it is a joy for me to introduce to you Governor Dr. Howard Dean.
Thank you.
Hello. Thank you.
Well, Dr. Dean, you have lots of friends and fans here, people who have appreciated your leadership as governor of your state, work you've done in healthcare reform, the outstanding campaign you ran for president that helped revitalize our country. There is no one who I think who didn't win who had a more transformational effect with the presidential campaign. And then you were willing to follow through with the work that you did with the 50-state strategy for the Democratic Party. And you are right. There are people here in this audience today who are part of it here in Oregon that strengthened the congressional delegation, sent another Democrat to the U.S. Senate who will fight for health care. And there is no doubt in my mind that the work you did was a critical part of the election of our president, Barack Obama. All of these things converge as we come together today for an area of unique opportunity for a problem that has persisted for over half a century in terms of trying to deal with issues of healthcare. We have, I think, a unique opportunity in Congress to be able to advance this agenda. This is a political event. It was organized by Blumenauer for Congress because we want to be able to raise the prospect of our doing things politically to try and encourage people in Congress to be able to advance reform, to deal with a health care plan that's available to all Americans, and to be able to break the political gridlock that has surrounded health care for decades. I have been involved with health care issues since I was in the Oregon legislature years ago, but 36 years ago, I guess. I worked with Multnomah County and then County Board Chair Don Clark, and subsequently as a county commissioner with him on things like our Project Health to try and streamline an old county hospital into mainstreaming patients, dealing with things like teen clinics and fluoridation. I found they've all been controversial, but they were worth taking a stand for, which is why I am so pleased that you're here to be a part of this conversation with us today. You get a chance to hear from me all the time, not as often with Dr. Dean. So I would like to if I could turn to you, we've run a little later than we wanted. The traffic on I-5 and an unexpected accident, but we would, not involving the doctor. But we would like to turn to you for some comments and then have a chance to engage in a conversation here about what we do at this critical time with health care in our country.
Great.
Doctor?
Earl, thank you. And I apologize for being late. It was one of those, mostly what could go wrong did go wrong, although we didn't have an accident ourselves, so that was a good thing. First, let me thank Earl for his leadership. He has been right there with all the stuff that needs to be done, as progressive as we can be, and as we work towards what we're trying to accomplish. I want to thank Jeff Merkley, who Democracy for America played a significant role, and I did too. I came out and campaigned for him at the end of the election. A terrific person. I also particularly want to thank Jeff for his advocacy of the LGBT community, which took an enormous amount of courage at the end of his tenure as minority leader. This is a guy who is he's in the right place at the right time. Let me basically tell you what this is about. The beginning of the election of Barack Obama was the beginning, not the end. The reason that I took the Democratic chairmanship was to elect a Democratic president. The reason I wanted to elect a Democratic president was not just to have a Democratic president in office. It was because you can't make any progress without a Democratic president in office. Now, we're going to have some disagreements with the Democratic president, although I have to say I think he's off to a fantastic start. I really do. There'll be some disagreements, but isn't it much better to have disagreements inside the family about how far we can progress and how fast, instead of whether we should be even doing what we're doing? So I'm delighted. Let me just say one other thing. The bipartisanship is a great thing. And this younger generation that elected Barack Obama, you know, in this past election, more people voted in this past election who were under the age of 35 than who were over the age of 65. This is the new generation's candidate. We're all stepping aside here. We're in an advisory role. But one of the things that this generation wants is for us to, in our generation, to put aside the fights that we've been having for 30 years and start working together. And so I think bipartisanship is great, but I do not think that bipartisanship in and of itself is the end. I think that bipartisanship is a means. And if we have to sacrifice a great health care bill or sacrifice bipartisanship, it's time to throw bipartisanship over the side and get the right thing done. We do not need a bill that passes with 70 votes or 60 votes. We need a really good bill, and I don't care how many votes we pass it by. If it's one vote, that's fine with me. Now, let me be clear about what we really have to have. There are a lot of things. Healthcare is incredibly complicated, and we could talk about it forever, and don't have the time to do that. But I think that this bill that President Obama talked about during the campaign is the best bill I've seen. I've been doing this since 1976. And the reason is not because it's a better system, because he recognizes why it is that we haven't done this before. The reason we haven't done this before is that the healthcare system is like Congress. Sorry, Earl. People don't like Congress. But they do like their congresspeople, and they keep reelecting them again and again and again, right? Well, people don't like the healthcare system, but they do like their doctor, and they do like the kind of care they get. So 80% of people have decent insurance, or maybe 70%, but 70 against 30 is always a losing proposition. And so the attacks of the Harry and Louise ad, which everybody remembers, and all these things have gone on back. The AMA attacked Medicare, because it was always on the grounds that you were going to lose something if you had insurance in order to help people who didn't have any. It's a losing argument. This president has framed it differently. This president has framed it in two new ways that I think are winners, although we're going to have to work like crazy to do it, because even some of the Democrats need a little help in shoring up. This president has said, first, we can't have an economic system that works anymore unless we reform health care. We are not just losing jobs to China, we're losing jobs to Canada, because in Canada, businesses don't have to pay for their health insurance. And they do pay more taxes, but those taxes don't go up at 2 and 3 times the rate of inflation every single year, which is what the health insurance payments do for our businesses. So we are losing jobs. Everybody who has insurance can lose their insurance and lose their jobs unless we change our system and change it now. That's the first piece. The second piece is the way that the president frames this is, we're not telling you what kind of health care. These guys outside are yelling and screaming they want single payer. There's nothing the matter with a single payer. I'll tell you one thing about a single payer. It is a lot more efficient, a lot cheaper than, it is absolutely true. It is absolutely true. But the president decided that what we're going to do, and I think this is the right decision, is give people a choice. Let them get into the public option, the public health care option, which is essentially a single payer. You know, we've had a single payer in this country for years. It's called Medicare, and it's for only people over 65. The president is saying, why don't we let people under 65 into something like Medicare? Let them choose. If you're going to hear this again and again in this debate, if you like what you have, you can keep it. We're not going to get Harry and Louise this time. We're not going to have those ads up there saying, oh, they're going to take your doctor away from you and all that. No, if you like what you have, you can keep it. If you like your private insurance, by all means, keep it. There is no single payer in the world that doesn't have private insurance in it. The Canadians have it. The British have it. In some cases, in Europe, it's all private insurance, although we run the utilities like the insurance industry like a regulated utility, which I don't think they'd like very much, although they probably deserve. But what the president is saying is really smart. If you like what you have, you can keep it. But if you don't have something that's very good, or if the insurance people keep denying you because you have a pre-existing condition or they charge too much, then there will be a publicly run health insurance option and every American will be able to choose it. That is what we're aimed at. And let the American people vote with their feet. If they want a single payer, we'll have one soon enough. One of the things the president says, which I think is right, is that'll force the insurance companies to stop doing some of the things they're doing. And it'll also force them to stop treating providers like dirt. You know why it's so hard to find a doctor? Because there's not very many general practitioners and primary care people left anymore because of the way the insurance are treating them. My wife, who's still a practicing physician, was not in favor of a single payer 15 years ago. Today, she says, hey, you know, we'd all be better off if we were under Medicare. Yeah, they don't pay much, but at least I don't have to deal with somebody at the other end of the line who doesn't know anything about the patient and is telling me what I can and can't order for my patient. We need a real change in our healthcare system, and letting the American people choose what that change is a politically good way of doing it. So let me get to point number one. We need to pass the president's bill the way it was articulated on the campaign. Putting $1.5 trillion into a system that we already have makes no sense, and we shouldn't do it. And if there's no public option, then there shouldn't be any health insurance reform, because it's a fake public option. And I'll give you 2 examples of a fake public option. One is the so-called trigger. That is a fake public option. There's nothing real about a trigger. A trigger says, well, you won't have a public option just yet, but maybe we'll put it in 3 years if the insurance companies don't behave themselves. We know what's going to happen. They'll behave themselves for 3 years, and as soon as the threat of the public option goes away, we'll be right back where we started. We do not need a fake public option. I don't want to borrow another $1 trillion from the Chinese and charge it to our kids' credit cards to keep doing what we've already been doing. Secondly, another example of a fake public option is the so-called state example. Let's do what the states do. Let's do what the state employees have. The state pays for their insurance, but the private sector runs it. Well, look, I'm a capitalist. I am. I think that capitalism has worked great in this country, but the free market does not work in healthcare. And the reason it doesn't work is not because the free market is evil or anything like that. It works great. It gave us this incredible system that hadn't worked so well in the last few years, but in general, it works very well. It's been great. But the problem is this. In Milton Friedman, not somebody I agree with, but Milton Friedman once said, who won the Nobel Prize for Economics, once said that the job of business is to make as much money as possible. I think that's fine and good. But the trouble is, if you're in the health business, you also have the job of trying to keep people well. And if you're busy taking money out of the patients' pockets and making sure that the CEO gets $5 or $10 or $15 million a year and the insurance companies get a 25% return on equity, then you can't do a good job at both things at once. Now, but I'm with the president. If you like what you have, you can keep it. If you want to be in an insurance system like that, there are some advantages. The private sector does some things well, better than the public sector will do. There are some things they're better at. Let the American people choose, but don't give the American people a false choice between a fake public option and what we already have. That is not worth the money. And we are here today to tell you that what Democracy for America is going to do in the next 6 or 8 months before we get this bill done is everything we can, along with SEIU and Healthcare for America Now and all these groups that are working so hard to make sure that we get a really good bill out of the United States Senate and the United States Congress. And you can do something about it. You can make sure that your senators and congressmen, I think Congressman Blumenauer has got an exemplary record on this one, but make sure that your senators both understand that you want a real public option. Now, all this hooting and hollering out here is kind of obnoxious, but it has a good purpose. It has a good purpose because there are a lot of people in Oregon who want nothing but a single payer. And we can argue about whether that's a good idea, and I think we're going to have some discussion about that. But those kinds of sentiments, those are important because dragging this debate to the left is what has to happen. We have to drag this debate as far to the left as we possibly can. Because this debate's going to, the Republicans are going to pull it back to the middle, and the so-called blue dogs are going to pull it back to the middle, and we need to have a public option. If we don't have a public option, we have failed. A bill that doesn't have a real public option is a failure for the Democrats, a failure for President Obama, and the American people can't afford that, and we can't afford any more Republicans, so we need a real bill. That's all I've got to say. Now let's hear from you. Thanks so very, very much.
Thank you again. Your energy, your passion helps all of us. Thank you again. The first, you've talked about it. We have all the folks who are out here asking about a single payer. You've articulated it. Congressman Blumenauer, how do you feel about the single payer concept, and how do you feel about the approach that people are taking?
Well, I think it was well articulated by Dr. Dean. It's kind of ironic that we have some people who are convinced that unless you have a single payer, that somehow it is a sellout to the insurance industry. And on the other hand, we have the forces that are supporting the status quo who are terrified that if the American public is given a choice of a real public option that is comprehensive and meets their needs, that somehow that is in fact a de facto single payer, and that they're kind of paired off against each other. The point is that we have a majority of people who do get their health insurance now through employer-based health insurance, that the majority of them are satisfied. We don't want to stampede people into anything. The only way we will fail is if, in my judgment, we create false choices and we have conflicts that we don't need. We have lots of examples of my colleagues in the Ways and Means Committee on the Republican side are talking about their terror of government bureaucrats dictating health care. Well, you just referenced a big single-payer program we have for Medicare that is government-administered health that is not administered entirely through the government itself, but it's in partnership with the private sector providing this government-sponsored insurance. We have another system in this country that my Republican friends are strangely silent on, and that's veterans' health. Veterans' health that is 100% government paid for, and you've got government-paid doctors and bureaucrats and government negotiating rates with pharmaceutical companies for drugs. And it has pretty good outcomes. It keeps costs down, there's high satisfaction with our veterans, and they are well treated, and they deserve it. Well, from my vantage point, the next step is having a comprehensive public health insurance option that is made available for people who want it, who need it, who are not satisfied with their private insurance or can't get access to it now. I think that's going to unleash the competitive forces. We're seeing some changes with some in the private health insurance industry. All health insurance isn't the same. We've got some outstanding programs here in the Northwest that have helped create a system here in Portland where we are providing better outcomes for less than the national average cost. In fact, we're being shortchanged right now by the way Medicare reimburses. I think we've got the elements there. They deserve to be put in place. I am supporting that in the House of Representatives. I will be fighting for that in our, as we go to markup, hopefully next month. I anticipate that we'll be starting subcommittee and full committee hearings in the next few weeks, and I hope it comes to the floor before the 1st of August. But I agree with what Dr. Dean said. It shouldn't be phony. I am struck by how the extremes of this debate look at the same threat of giving the American public a real choice and convinced that that's a defeat for both of them. I don't agree. I think that's a win for the American consumer.
Okay, we're going to start off with questions. I'm going to have, again, it's 30 seconds, and if you start to give a speech, I'm going to finish the question for you. That's just a warning. We have a number of folks who are asking different questions here. I see hands all over the place. So we're going to do, let me tell you what we're going to do. We're going to do questions here, then I'm going to go to a couple of questions here. I'm going to go to some of the questions that have come from the overflow room, and then we'll come back to questions here. Okay, so I've got hands up like crazy.
Hi, yes, I wanted to ask if there's any way you're considering incorporating aspects of food safety inspection, like into this plan, or how that might be seen in the future incorporated into public health.
That's an incredibly important question, and the answer is there is some consideration. There's actually a bill on the floor of the Senate now which makes tobacco regulated by the FDA, but that's nibbling around the edges. You've asked a whole different question, which in some ways is a more important question. It's going to save more money than healthcare reform, and that is changing our system from an illness-based system to a wellness-based system, and that is absolutely critical. It's absolutely critical. Now, we got a lot of work to do there. Changing the finance structure is not going to fix the whole problem, no matter what kind of system you end up with. We have got to change the American mindset, and it is happening slowly. There are some things that are going on. Interestingly, the private sector is leading in that one, too. The private insurance, people who have employer-based insurance with big companies and group rating, they have guaranteed issue and community rating, which means you can't be turned down or excluded for a condition. And a lot of those big corporations, in order to try to save money, are now putting in wellness programs. So there's a step in the right direction. Look, if we end up with a public option, which I really hope we do, because if we don't, we shouldn't bother to waste our time anymore. We should do other demonstration projects. But there are a couple of things we ought to do. First of all, you ought not to be allowed to sign up for the public option unless you have a medical home. Because right now, the care is willy-nilly. And it's not just people think, oh, it's just poor people that go to the emergency room and that's their... Wealthy people who have lots of money go to 6 specialists and don't have a nurse practitioner or don't have an internist or a general practitioner, and so there's no coordination of their care. Secondly, and this is an even bigger issue, we have got to start educating people about what folks are putting in our food. I mean, look, as a physician, I get nervous when a whole lot of antibiotics are going into all the beef you eat or hormones and stuff like that. I mean, let's just suppose it doesn't have an immediate health care effect on you as a person, which it may or may not, but there is a huge problem in this country with antibiotic resistance, and the major reason for it is that we are using antibiotics as if it was water all over the place, and of course there are bacteria that are... So there's a tremendous amount of change, and there is a personal responsibility act to this too. We cannot deny, look, it's all nice to blame everything in Congress and the medical industrial complex and the insurance companies and all that stuff. The truth is we have some responsibilities here. One of the biggest responsibilities, I talked about a living will and a durable power of attorney, is what makes this country great is also partly why our health insurance bills are so high. This is an incredible country, and it really is a different country than every place else. Not because Americans are better than Europeans or Asians or Africans as people, But as a country, we have this incredible well of boundless optimism. We think we can do anything. We really do. And we do. We believe we can accomplish anything if only we're willing to work hard enough and spend enough money. And the problem is that also includes conquering death all the time. What is it? 50% of our healthcare dollars are spent in the last year of our life, but they don't give us better qualities of life. Now, we can't have some group of people who decides who's going to live and who's going to die, but you can decide that for yourself, and that's why you should sit down with your family ahead of time and have a living will and a durable power of attorney to have that kind of a discussion. That's one of the things that we need to do. The food stuff you talked about is very, very important. There's a huge debate about what our personal responsibility is. I don't know, I hesitate to say this in Oregon, in this libertarian state, but every state ought to have a requirement that if you're going to drive a motorcycle, you wear a helmet. Because if you don't, it's not just you're killing yourself. Everybody insists they have the right to kill themselves. Well, maybe they do, but what about their kids? What about the fact that they don't die right away, but they use up $200,000 worth of health care in the emergency room? Seat belts. Reasonable firearms laws. We're not trying to take away everybody's guns, but I fail to see why you ought to have a target shooting range next to the door to somebody's house. Some guy just got we have no gun control laws in Vermont at all. Okay, fine. But somebody set up a target range right next door to somebody's house and just killed him a year ago. Let's just use some common sense and stop sloganeering about stuff that we have some responsibility over.
There are pieces in place right now to try and put in practice what the good doctor's talking about. We're working very hard to make sure that Medicare, for instance, pays a doctor to sit down and have a conversation with a patient and their family about end-of-life options. We will pay for unlimited tests, but we won't give them a couple $100 to sit down, help them understand what they face on things that will be better reflective of what is in their best interests and for the family. We need to reform the farm support system where there's a reason, as Michael Pollan points out, that a package of Twinkies with 43 ingredients costs less than a bunch of carrots. We need to provide support for farmers that grow food in an environmentally sustainable way, rather than lavish subsidies for commodities that the world has enough of and that damage the environment and damage poor people around the world. These are elements that are part of this broader health agenda, and the President, to his credit, has identified these as part of his agenda that I'm hopeful that we'll work on, whether it's agricultural support reform or the First Lady planting an organic garden on the lawn of the White House.
Got a microphone right back there already. Yes.
Hi, Felisa Higgins with SEIU. I would hope that both of you could talk about the reforms that you're thinking about in workforce and workforce development when it especially comes to primary care providers, the nursing home and long-term care industry, which I think we care deeply about.
Well, first of all, let me thank SEIU because you're organizing not just nursing home workers, but home care workers. Because the future of nursing home nursing homes isn't. There's always going to be some nursing homes. Well, I got a waiver from the Clinton administration when I was governor, and we could start using Medicaid to pay for home care. The reason for that is most people in nursing homes don't need to be there. They end up there because they can't stay home by themselves, and their families are 3/4 of the way across the country. And so we had a program which does what seniors want and is good for the budget, which means you could get government help to stay in your own home and get the kind of care you needed for people, for example, who couldn't cook because they'd leave the gas on but weren't sick enough to be in a really intensive nursing home situation. That saves us a fortune, and you can take care of more people. That's kind of stuff we have to do to save money. In terms of workforce issues, the first is, and I see Terry Mills here from the National Nurse Program, she'll be happy that I'm about to say this. I got to tell you, as a practicing internist, 60% of the stuff I did could have been done by a competent, well-qualified nurse practitioner. And we should use, it's true, and we should use physician extenders more. On the other hand, a lot of the stuff specialists end up doing now can also be done by a primary care doctor. So we need to kind of kick things down the chain. I mean, I'm not advocating here that you let me practice cardiac surgery. You're going to be in big trouble if you do. But you know, we end up, right now, all the incentives are, the more you do, the more you pay. Competition works backwards in medicine. The more stuff you have available, instead of the price going down, it goes up. You build 3 more cardiac catheterization labs in town, more people use them, and the cost goes up, not down. It is a crazy, crazy system. If you really wanted to fix this, and giving the government the opportunity to run a public insurance option at the blessing of the American people, they get to choose if it's going to be successful or not, allows us to do, for example, eliminate fee-for-service medicine. Fee-for-service medicine is crazy. And it's not, I think doctors should be paid well. You know, today, the doctors in Great Britain, primary care doctors, make more than primary care doctors do in the United States of America. I mean, you know, this is nuts. We're destroying the very people who, at the front end, who can coordinate your care. What Earl said about paying people, you pay people to do all kinds of stuff and stick tubes everywhere, but you won't pay them to sit down and have an hour conversation with a family that really has to make some really big decisions. The system doesn't work. All that stuff has to be changed. So here's what I'd do. 1, you want more primary care people, you got to stop having people leave medical school with $150,000 worth of debt and forcing them out of primary care. 2, there is no reason, we did this in Vermont, there was a big hoo-ha with my own profession, let nurse practitioners practice independently. There's no reason not to do that. There has to be, I see we have the nurse practitioners well represented here, but there has to be some, of course there's supervision, just like doctors have, but there are things that nurse practitioners can do that don't need people who've gone through 4 years of medical school and all that stuff to do. Thirdly, spend some time rationalizing care, and the way to do that is have vertical integration. The best private health care, I should say class. I'm not going to just say one person. I will mention this one company. But the kind of healthcare I'm looking for is Kaiser. And why? And let me tell you why. Kaiser is vertically integrated. Now, here's the, this is a little complicated, and I apologize for taking the time. But I just ran into some people in San Diego. This is my Western trip. I started in San Diego and worked my way up the coast here. And so this guy comes to me and says, I have an invention. I don't know what it costs, but let's say it costs $3,000, where you can put essentially an electronic Band-Aid on somebody's chest and monitor their blood sugar and their blood pressure and a whole bunch of stuff like that. So we can check on the wireless network how diabetics and people with congestive heart failure are doing without them even having to see a doctor. And because we can do that, the minute we know they're in trouble, we can get them to come in and see the doctor, so we can save a couple of $40,000 a year ICU visits, right? The problem with our system today, for the most part, and places like Kaiser are an exception, the hospital doesn't see that as a savings. The hospital sees that as a loss, right? If you had the same people running the hospital ICU as were running the internist's office, then the $3,000 investment would be a great investment for Kaiser, because in the back end, they could trim down their resources in the ICU or use it for sicker patients or not have a waiting line or whatever it is. But if there's no connection between them, it's a problem. The same with the nursing home industry. If you had nursing homes that also had home care and also had assisted living, there would be a gradation of treatment, and it would make sense for them to take money out of their acute care beds, which was being wasted, and stick it into early care in the home, which is what people want anyway. So we got to have some vertical integration, because we can talk about all the savings that we want, but unless somebody in the, and it doesn't make any difference if you're a private nonprofit or a for-profit here, you still got to balance the books. And if your institution is not connected to where the savings are, you see the savings that we see, what we see as savings, you see as a big loss, and then you go to your congressman and put pressure on him not to pass the bill because you don't want that loss. Your hospital's going to close if people don't get really sick, and we want them sicker so we can fill the hospital. That's essentially what our healthcare system does, and it's nuts.
The workforce element is something that a number of you have impressed upon me. There is a role for everybody. The general practitioner, where we are not providing in sufficient numbers and they're not getting the rewards. What's happening for nurses, home health treating people in the vast array of the health system with dignity, making sure that they are given incentives to practice what it is that they do well, and that for people to be able to select a competent person to help them and change the incentives so they aren't perverse, are absolute bedrock, not just of the private health plan, but that the federal government needs to change its approach to medical education and to Medicare so that this is reinforced and we coax more value out of it while we enable the medical professionals to be able to do what they do well. And we're going to have to be more serious about dealing with that medical education and the burden of it. There's a bunch of us geezer baby boomers here, and we're facing some severe workforce issues. It's already upon us in some parts of the country, and we need to get these incentives aligned properly so that we can have the appropriate workforce. When we do reform the system, it's still going to require people being able to do that, and we need to make sure that that is a critical part of the reform, apart from the health insurance option.
Okay, here's what's going on right now in terms of timing. We need to be leaving here. Dr. Dean has an appointment that he's supposed to be at. He's going to need to leave here at 5:10. That is in 8 to 9 minutes at this point. We'll cheat a little bit, okay. I have promised that I would read at least one question from the overflow crowd, so I'm going to do that in just a second. And it's a short, relatively short question, but we also need some short answers from you folks, okay? I don't get a chance to do that,
complicated
you know?
subject.
Ouch. Ouch.
So, the question is coming from Martha Perez. She says, I work in the healthcare insurance industry, concerned about the access question. We are canceling our contracts with providers and have 8,600 patients who haven't been assigned to a doctor yet. What should or could be done?
Well, that's a perfect example of why you need a public health option, public health insurance option. Insurance companies behave like that. Bang, off you go and sign up for the public option. The public option, first of all, it's like Medicare. It can never be taken away, and it follows you wherever you go. You want to change jobs, you have the unfortunate problem of getting fired, or you have to, sometimes this happens very often, somebody starts a family, the mom wants to stay home for 5 years until the kids are old enough to school. Now she's out of the workforce, now she's got to find a place that will hire her, but it gives insurance benefit. You don't have to worry about any of that with a public option. So that's why, the answer to a lot of these kinds of questions is going to be, you got to have a public health insurance option, because that solves a lot of access. That solves essentially all the access problems, because it's subsidized according to your income.
Nope. Okay. I got a microphone right. He's passing. Oh. What? Judith. Okay.
Hi.
I'll get you first, and then Judith. Okay.
Okay, thanks.
Thank you.
I'm an emergency medicine physician, and I just haven't heard a lot about how the emergency medicine portion of things will be dealt with. I know that, right now we're the only unfunded mandated care that is provided in the entire healthcare system, and the vast majority of people who go to emergency departments, contrary sometimes to public opinion, aren't just poor people getting primary care. It's people with actual emergencies. So how will that be approached in your current system, your proposed system?
The bill hasn't been written, so you can't answer that set in stone. But in general, if you have a public option, you will have a medical home. In fact, I actually think the bill's going to be written so that everybody's going to have a medical home. They're going to require insurance. They're going to change the insurance industry, too. They're going to require probably guaranteed issue and community rating, which means you can't be turned down. And I suspect there's a lot of discussion in the Senate Finance Committee right now about medical homes. So it may be, at minimum, everybody in the public option is likely to have a medical home. And it's likely that everybody's going to have a medical home. The first call, and the way that works is, and there's a phrase for it which I've forgotten, but because we have something like this. And actually, the Oklahoma Medicaid program, for example, there are some states that are fiddling around with this. It says that the hospital will not be reimbursed for somebody who arrives at the door, and they have the full right to turn them away to a triage or a medical home, unless a reasonable person would conclude that they had something that allowed them to bypass their. In other words, you basically got to call your doctor before you go to the emergency room, except in really extreme situations. I think that makes sense, because probably 80%. If you call somebody, I mean, my wife is on call, every 3 weekends or whatever. People call her with chest pain. She knows the ones that have had chronic acid reflux and the ones that have never had a symptom like this before and got to be sent right to the emergency room without coming to the office first. That's why you need a medical home, because you're much less likely to have a mistake with somebody who really knows you. And so that's really the cure. Now, in big public, I worked in a big public city hospital when I was in medical school, and they basically had a triage clinic right then and there. I mean, if you came to the emergency room and had something that wasn't appropriate, they just sent you next door, and then you had to wait. Waiting in line, you shouldn't have to wait online because you're poor. And old people don't have to wait online because they got Medicare, and people generally don't discriminate about their income because they all have the same insurance system. Well, basically that's the attraction of the public health insurance system. Everybody gets relatively the same amount of treatment, and the system has to be ordered. It has to be a reasonable, organized way of delivering systems, and it can't be haphazard. For example, something incredibly simple, we all ought to have the same insurance form. There's no reason that that's just a small thing, but it would save millions and millions of dollars. I mean, our system is a non-system. It is insane. And the anchor for the reform is the public health insurance option, because you'll have one big system that won't include everybody, but it'll include everybody who wants to be included.
But demystifying the health delivery system so people understand what they've got, everybody is covered, eliminating uncompensated care that is a drag on emergency room provision right now. The medical home, I could not agree more with Dr. Dean. You start putting these elements together, and I think you radically change the environment that most of the people I know who work in emergency rooms face. It's not going to solve everything, and we look forward to working with you and your association and people who have suggestions. But I think these 4 things are going to make a huge difference.
Judith, you had something you wanted to ask?
Hi, my name is Judith Auslander. My question is that with the Medicare type of system that you're suggesting, how much are you going to implement preventative care into it, such as dental, such as vision? With OHP, you don't have dental and vision, or the standard at least. And also, I know my cousin is on Medicare, and her teeth are falling out, but how is she going to chew and get the nutrition she needs if she can't go to a dentist? And it's thousands of dollars to replace the bones that she needs.
This is again one of the, as I said before, we're arguing in Washington about the payment system, about the finance system. We don't even touch the prevention system yet. But until you organize the finance system so that we can create incentives to do this, it's never going to happen. We've always been talking about, well, we got to do a wellness system first, and we got to do a preventive system. No, we've been doing this for 60 years until you fix the incentive system, which is a non-system. The reason that what you just described happens is because Medicare, now, the Republicans will say, oh my God, Medicare is going to go broke. That's true. It will pretty soon if we don't do something about it. But the rate of increase in Medicare costs is about 50% above the rate of inflation. The rate of increase in the private sector is about 250% above the rate of inflation. Some of that, in fairness, is cost shift from Medicare. But a lot of that is just it's the incredible inefficiency of the system. The first thing you need is an efficient system of finance. Then the next thing you need is to change the incentives. If, for example, let's just suppose we did have a public health insurance option and everybody in this room signed up for it. The smart thing to do would be to put in tax incentives to encourage there to be vertically integrated care, and then make contracts with Kaiser or who are the new entrants into the market, if we diddled around with the tax code so it paid them to get into it, and say, okay, we will give you X amount of dollars for every patient that you take, and you will be responsible for their care A to Z. that seems to make sense to me, because now if you're dumb enough not to make sure they have teeth, you're going to pay for it at the other end 3 times as much. And now you've put the whole system into one place where the savings in one place really is realized in the same organization someplace else.
But putting dental health, I mean, the notion that somehow that's separate and is tertiary, that is fundamental to human health. We had a famous case in Washington, D.C. a couple years ago where for want of regular dental checkups, a young man died after having incurred hundreds of thousands of dollars of expense paid by the public because of an infection that felled him. We will work very hard to make sure that dental health is a part of this as well.
Okay, I'm going to do one question here, and then I'm going to ask you two, if you wouldn't mind, after that, telling us what we can do. So as you think about that as well. The question is coming from Gwen Randolph over in the other side there. She says, Oregon has nurse practitioners in school health centers, school-based health centers. These centers treat and prevent and educate the health of young people, saving medical costs. Could we expand these to become community clinics and treat all ages at these centers?
Well, not that I would ever want to say a kind word about a former president, but one of the things that George Bush did right, and there weren't many, he increased funding for federally qualified health centers significantly, and that was a very important thing to do that. When I was governor, we actually put dental clinics in schools. Dentistry is a little bit of a different game because most dentists are small business people. There's a big overhead. You know, a doctor who's a primary care person can buy an EKG machine and a few things like that. It costs money, but a dental chair and all that stuff is really expensive. And Medicaid doesn't pay them what it takes. So we had a long discussion with our dentists, and we discovered that they would be very happy if we would take low-income kids off their lap, and frankly, the low-income kids would get better care. And so we started putting dental clinics in schools in low-income neighborhoods. And they were manned, and the state would pay the whole tab for the upfront fitting of the thing, and we would often use dentists who were kind of wanting to retire but didn't want to quite quit yet, so that they would, because 3 days a week is more than you need in a school of, say, 600 people. And so folks would come in, and they'd work 3 half-days a week or something. They'd get paid. They'd have no cost. The state would pay for everything. And it was a win-win for everybody, including the practicing dentists. So there's a lot of stuff like that you can do. And yeah, we ought to use, clinics are going to be the model of the future. And you know, we're already getting, I mean, this is again, the private sector should get some credit for this. And in this audience of presumably Democratic liberals, I hesitate to say a nice thing about another foe, Walmart. Walmart, and doctors are driven crazy by this, but it's a great service to young people, has walk-in clinics and pharmacies now. It's very controversial. Doctors don't like it. I suppose I probably wouldn't like it if I had my doctor hat on. But young people who sit in front of the internet are not used to making appointments and driving someplace and telling their story. They just want to get served. And what better place to do it than this enormous, ubiquitous institution that we have. So thanks to SEIU, Walmart is behaving better than it used to these days on a number of areas. But I mean, look, we need a lot of room for innovation and ingenuity. The government can't do this all by itself. There are going to be things that are innovated and done by the private sector, but we've got to change the financing system so there's incentives, and then we've got to change the delivery system by using those incentives in order to make it easier for the private sector to do some of these innovative things that we're not going to probably do.
I agree with everything the doctor said, but I would fight to keep school-based clinics.
Right, absolutely right.
Having been on the receiving end of some pretty unpleasant political cross-currents, I will tell you the school health professionals that I've met developed a rapport with students in the intimacy of the school setting that wouldn't happen. Maybe it happened, you can do some of it in a Walmart, but I think for a 6th grade girl.
Well, I was thinking of the teenagers and the 20-year-olds, not so much the 6th graders.
Well,
but you're right. I think we agree on this one.
Yeah, but I would, if anything, I would like to accelerate these school-based clinics. I love the idea of the dental service being there, but kids particular in a lot of areas, need that specialized care, and the men and women who provide it in our community are just amazing.
Thank you. I'm going to go back to that question. You have, sitting in this room, you have folks listening elsewhere who are, in fact, leaders in their community. They're leaders in their neighborhood. They're leaders for their next door neighbors. They're leaders in their churches and other religious groups. What can they do? What would you like for them to do now, next?
I'm going to let Earl go first on this one because you're a member of Congress and you know how to influence your folks better than I do.
You know, I'm a little jaded because I'm from Oregon, where people tell me what to do all the time. And sometimes my head is spinning because with equal vision, gusto, and enthusiasm, I hear sometimes conflicting points. My purpose in sponsoring this and having Dr. Dean here was to try and expand the conversation, not to try and avoid the debate. You know, you can decide the merits on your own about single payer or about the government-provided health insurance plan. But we are, I think, desperately needing people who are involved with any connection, any network, whether it is your church, your union, your Christmas card list. We need you to be sending the articles, to be engaging people, to make sure that, particularly in the Senate, where it looks like we have to have a supermajority to determine whether or not this is 2009, we need to make sure that there's a sort of a steady tattoo, and we need to promote more conversations like this in forums. You've seen that we politicians are a lightning rod, and sometimes it's not always the easiest thing to have a thoughtful, polite dialogue. But you can develop things with house parties, with organizations that you're involved with, to raise the temperature and the intensity, because this is the year. And it's why, Howard Dean, we are so excited that you were here. The work that you're doing around the country is, I think, pivotal once again. So I would like to extend my thanks to you. And
thank you. Let me, first of all, Earl, thank you for doing all this and organizing it, and thanks to your hardworking staff for all that they have done, and the Oregon Democratic Party. Let me just say a couple of very quick things. First of all, our argument is actually not with the people outside. Our argument is with the folks in Congress. And you should understand a couple of things. First of all, you know, you can do a lot of hooting and hollering and writing letters, but the people who care about what you have to say are the people who you vote for. So it doesn't do you any good to try to influence Senator Baucus if you happen to live in Oregon. But if you have relatives in Oregon, aha. If you have a net organization that has ties to Montana, aha. So that makes a difference. Ron Wyden, we don't know where he's going to be on this debate yet, and we need to, you all can do a lot with him and push him very, very hard, and you should. But your message has to be clear. You can't go out there and say we need the 79 things done that we know have to be done, or if it's 179. You ought to focus on a couple of things. So it's a very clear, focused message. And the clear, focused message has got to be there must be a public health insurance option. Because that's not enough. But if you do that, you're over the hump, the core reform piece that we've never been able to do. Otherwise, all you're doing is extending what we have, and it's just not going to work. And all it's going to do is get us deeper in debt and make it harder to reform the next time. So there's a website, standwithdrdean.com, if I may be so shameless. You can go on there.
What was that again? What was that website?
Standwithdrdean.com.
Standwithdrdean.com.
Right. You can go on there, and you can find all kinds of things that you can do, you know, letter writing, forming nets, going to rallies, talking to people. And I also think what Congressman Blumenauer has said is really important. Quiet conversations make a big difference. You can sloganize this thing to death, and it's unbelievably complicated. But focusing on one or two things, and I would suggest you start with making sure there is a real, not a fake, a real public health insurance option. And I promise you that if a group of activist Democrats in this room make it clear that that is the price of support, and that is the price of getting out and getting excited about candidates, they will respond. They will respond. You do, as I used to say, you do have the power, and I hope you'll use it for this debate. Remember, this wasn't just about electing Democrats. We put them there for a reason. Doesn't do any good to have a Democratic majority in the House, Senate, and a president of the United States if we can't then deliver the things that we care about. That's why we did it, not just so we could say the Democrats were in power. Thanks very much.
Thank you all. Thank you, Dr. Dean. Thank you, Congressman.
Portland Community College, thank you for hosting us here.